Seems the fourth wave is arriving in South Africa. Numbers are building every day. Gauteng, of course, recording 80% of the cases. So what does this mean for government's festive season, safety plans and possible travel between the provinces? Our reporters Heidi Giokos and Nqobile Madlala join me now to unpack this. So Heidi, let's start with you. The Health Minister speaking this morning, but generally we're getting a bit more information about who is being hospitalized, which is one of the key markers we watch when the COVID numbers start to increase. So who is ending up in hospital?
Sally, a very different picture to what we experienced during the second and the third wave. During the second and the third wave, we understand those 50 and above and 60 and above were being hospitalized. Why is that? It's because we didn't have access to vaccines and the country wasn't vaccinating as much. The picture that we are getting now, because during this fourth wave, is that those under the age of 5 are being hospitalized. It's quite an alarming picture, although scientists do caution that we should not panic as yet. It has a lot to do with the fact that a lot more testing is being done, and they are being able to pick up that those under the age of 19 are testing positive for COVID and, of course, being hospitalized. What's crucial to understand is that many are asking the question, why would somebody under the age of 5 be testing positive and being hospitalized? We know that they're more susceptible to getting COVID-19 because they are unvaccinated. We know that the exposure might be a lot higher, especially because they are unvaccinated. And this is just some of the reasons that have been given by the NICD health experts to say this is the trend we are picking up. And it's also important to caution the fact that it's not very serious. So there is hospitalization, but nobody has needed to be put on a ventilator under the age of 19. It's mild cases and they are monitoring the situation very closely. But of course, it's still alarming to think that people under the age of 5, young children under the age of 5, are being hospitalized. Let's listen to the NICD on that.
We've been following the resurgence in Tshwane, and over the past 2 weeks, out of 4,000 or so cases and around 640 hospital admissions, we've seen admissions in children under 19 years of around 172. And particularly children under 2 years made up 11% of all admissions.
Yeah, and I guess, Heidi, as well, we've also heard that parents are really concerned, and a lot of those little ones are staying in hospital not for very long at all. But still, it is a very worrying issue to look at. Also, we've been cautioned by the doctors to remember there's a difference between COVID causing your hospital admission and being in hospital perhaps with something else, and that you happen to have COVID. But certainly something we must watch. We know that Gauteng is the epicenter at this stage. We are seeing cases tick up, but nowhere near here in Gauteng. Of course, the question is whether the President is going to be addressing us and whether we're going to be locked down. The general consensus seems to be that he's unlikely to do that. But what are you hearing, Heidi?
Yes, Ellie, I just quickly want to go back onto the points that I didn't make in the first question regarding those under the age of 5 being hospitalized. What's interesting that the NICD has picked up is the fact that when somebody under the age of 5 tests positive for COVID-19 and is hospitalized, the analysis and the sampling that's coming through is that in a situation like that, you will find that either one of the parents has not been vaccinated. So in most cases, what the NICD has picked up is that the father will not be vaccinated, but the mother will be. And we do know that there is a call for men to go and get vaccinated, as men aren't heeding the call to get vaccinated. On your point of whether or not there's going to be any kind of lockdown, considering what the president said on Sunday, he basically said, sent out a message to say the responsibility is on each South African to adhere to the regulations, but also utilize what they call the tool that can protect you from severe COVID-19, which is the vaccination. And We do know that most cases are here in Gauteng. The majority of cases are in Gauteng. 80% of infections come from this province. We know Omicron has spread throughout all 9 provinces, but Gauteng remains the epicenter. A very similar picture to the third wave. Many people are asking, are we going to have a lockdown just here in Gauteng like we did during the third wave? But the premier of this province says that's very unlikely. He says the answer isn't to impose serious and very strict restrictions, which he considers being a lockdown of the province. He says the answer is to vaccinate. 8 million people have not been vaccinated in this province. Only over under 4 million have been fully vaccinated. That is a problem for this province. They need to get more people vaccinated. So hopefully that can come through. But let's listen to the Premier on why he thinks there should not be a serious lockdown, particularly here in Gauteng.
We didn't have vaccines during the first wave. We didn't have vaccines during the second wave. At the height of the third wave, we only had our health workers who were vaccinated and the elderly. But now we have more people, even young people are vaccinated now. That's the most powerful weapon in our hands. Obviously, we would like to avoid the things like shutting down the economy. The lockdowns were very good for the phases in which we were. In the early phases where we didn't have vaccines, the lockdowns did their work, but we don't think we should be doing lockdowns now. There's been lots of hurt to people's livelihoods, to businesses, to incomes, to jobs. We have lost lots of jobs. So we just need to take the most positive step, and that most positive step is vaccinate. Don't shut down the economy, but vaccinate.
Very quickly, Heidi, do you have the latest vaccination stats? We're hearing that people have actually, in the last week or so, come out in their numbers to get the jab.
Yes, Ali, if you just give me 1 second, I can give you the exact stats. But we do know from what the Premier said yesterday, in fact, during the Coronavirus Command Council briefing here in the province, that the numbers are increasing, especially here in Gauteng, ever since the new variant was identified. So it seems as though the numbers are on the increase, still not where it should be. Unfortunately, I can't find that tweet where it shows all the vaccination numbers, but we do know it's still reasonably low. But according to the Premier yesterday, which I think we should all look very closely at as Gauteng province, is that he did identify the fact that they're back at over 50,000 vaccines administered per day ever since the Omicron variant was identified. So I think that is important to highlight. We're still nowhere near where we should be, but hopefully these Wilma vaccination weekends, we will be able to get those numbers in.
Absolutely. So thank you for that, Heidi. So Nqobile, I'll bring you in here because you've been focusing on safety of a different nature, not health safety and concerns about our health, but also about the festive season. A festive season safety plan in terms of making sure we're safe when we're out and about, safe on the roads, safe from crime. I'm wondering if it's affected by being in the fourth wave and knowing that, of course, we still have a curfew in place.
Well, Sally, quite interestingly, I did in fact ask our mayor that very same question, if it is influencing the way they are going about with the safety concerns on the street now. And she did say that this is the point where they have felt that it's important to include it as part of the safety. At this point, they are teaching people. They're saying that raising awareness seems to be the key at this point. So they are raising awareness about the virus, but also at the same time, what they were doing was they were looking at whether or not people are following the COVID-19 regulations, at the same time making sure that people are safe and ensuring that, of course, there's less accidents on the streets. So it is somehow also coming in light with everything that we have moved on to be, Sally. You know, in the beginning they called this the new normal, and it seems the new normal on the streets as well is to ensure that the motorists as well are aware of the COVID-19 and that they continue to follow the protocols. And this is what the mayor said she was going to do. But that's all also, Sally, she was saying that she was ensuring the JMPD, telling them that she will make sure that the MMC that will be in charge will speak to them, and also said that she's aware that there are certain things that they have been concerned about, as well as saying that she knows that there's not enough numbers at this point, but she's looking into adding units, and she's looking into ensuring that there is a good communication between those that the JMPD as well as her office. But she did walk around, of course, looking at whether or not the safety regulations were followed on the street. But let's listen in, because we did get to speak to her. The festive season is almost here. According to past crime stats, this is the time where crimes like hijacking and drunken driving is at all-time high. And in the wake of the new Omicron variant, COVID-19 regulations must be enforced. City of Joburg's new mayor is hoping to do just that by tackling crime and this defaulting on COVID protocols. She says there will be more units to assist in alleviating crime in the city of gold.
Like land invasions in Joburg. Joburg attracts a lot of people in search of opportunities. They come in and sometimes they do occupy land where they're not supposed to. So we will be having a dedicated anti-land invasion unit that's going to clamp down on land invasions. Another issue is in the electricity space, where we have a lot of illegal connections. We've got cable theft. We've got vandalism of infrastructure, such as our substations. So we're going to, again, have a specialized unit to look at that and clamp down on it.
And authorities are already on the ground.
Well, officers will be checking for unroadworthy vehicles, for driver and vehicle fitness, and also for illicit substances and dangerous weapons. We do know that in the festive season it gets really busy on our roads, so the aim for the Johannesburg Metropolitan Police Department is to ensure that there is a reduction in road fatalities in Johannesburg.
The mayor says investors are always concerned about the safety in Johannesburg, and she's committed to supporting law enforcement agencies as much as she can. Nqobile Madlala, Johannesburg.
Nqobile and Heidi, thank you so much for those updates. Let's move